We'll go ahead and get started. I want to quickly introduce Alex Freeman. It was his idea to kind of put this event together, so I want to turn the ball over to him real quick so he can kind of explain what we're all doing here.
Great. Well, Scott, thank you, first of all, so much for convening such a great group here today, both socially distanced in person and on Zoom. I see we have 19 people with us digitally, virtually here, and then it looks like you have a great group there as well. And so, yeah, like Scott said, this is an effort from the Public Awareness Committee and the Iowa Council on Homelessness to meet with our housing providers across the state in a way that really meets them where they are in their communities, to learn more about their missions, to learn more about what they're doing, the things that are important to them, and how they're going about solving the challenges that arise in their communities. And I see we have a number of important community leaders from the Muscatine area with you in person in attendance today. And Scott, as you know, and as everyone knows, this is a community effort, as a statewide effort to end housing issues and homelessness in Iowa. And so for our committee to be able to convene and speak with people about their missions is really the focus of this. So today we want this to be about MCSA. We want this to be about learning from you, from the council perspective, but then also we wanted to convene and give everyone kind of a platform here to collaborate and talk about challenges that we faced in 2020. There is no shortage of those, I'm quite sure, for you all, but like I posted on my Facebook yesterday in anticipation of this event, I know that you guys spearheaded those challenges head on in 2020. You continue to do what you've done since early 1990, if I remember, 1991. And I have no doubt that in 2021, MCSA will continue to do the great work that it's been doing since then. So Scott, thank you again for putting this all together as far as the group goes, and the council is more than happy to be here with you all today, and we're excited to learn more.
Well, thank you, Alex. I'm going to take my mask off while I'm talking. I timed myself. I'm going to warn you ahead of time. It's going to take me 15 minutes. I tried to cut it down as much as I could, but there was just so much important stuff to say that I had to squeeze it all in there. I want to thank the folks that are with us today, with us here in the room today. The Honorable Mayor Diana Broderson, thank you so much for coming. Newly appointed Lieutenant Vince Motto, who's also on our board of directors. Tim Wilson from the Iowa Council of Homelessness, and you're also with Home Forward Iowa. Jody Royal Goodwin, who's the Community Development Director for the City of Muscatine, as well as a member of the Iowa Council of Homelessness. The amazing and legendary Charlotte Schaefer, the Director of Community Foundation and funder here in Muscatine. I know virtually we're supposed to be joined by, and I don't see their names up there on the TV, but we're supposed to be joined by Angie Johnson, who is the Director of the local hospital. I see her, she's waving. The Director of the local hospital and Chief Human Resource Officer for Unity Point Health, Trinity. We're also being joined, again, I don't know if I see her or not, by Dr. DeWinter. She is the president of the local Muscatine Community College. So, with all that said, for those of you not aware of MCSA services, please let me outline the structure. This is why it takes so long, because we have so much going on. We have 3 emergency shelters: a family and single women's shelter, single men's shelter, and of course a domestic violence shelter. We have a homeless prevention program, which currently also includes a rapid rehousing program. You'll find a food pantry. You'll also find our affordable rental program, 70 units of affordable rental. That completes MCSA's 4 basic needs programs. However, we have also partnered to offer the following programs to advance folks just past just their basic needs. We have a wellness clinic with Unity Point Public Health, a dental clinic with Community Health Care, a vision clinic with Family Eye Center, a peer mental health drop-in center with the Robert Gunn Center, an integrated health home program with the Robert Gunn Center, crisis stabilization services with the Robert Gunn Center, child therapy and VHIS services with Family Empowerment. All of those can also be found on site here at MCSA, but we also partner to offer off-site a rapid upskilling welding credential with Muscatine Community College, a job training program with Crossroads Incorporated, a rapid upskilling program for CNC welding CNA with Fuel in the Future and the Community College. We have also been instrumental in developing a collaborative professional case management consultation service for the Muscatine community. Lastly, this year, we hope to finish off our efforts and complete the addition of a full-service medical clinic at our lower level. I was talking to a friend recently, and in our conversation, he stated that he heard me once say that we, MCSA, were gonna end homelessness in Muscatine. He stated he was proud of my optimism, but while he believes in what we do, he doesn't really think this can be accomplished. I thank him for his candor and reflect on the conversation for many weeks, and in fact, still reflect on it today. I think the feeling is felt across the nation. While some don't think the issue is that severe in our nation, sadly, even more have lost hope in our nation's ability to successfully tackle such complex social issues. My team and I are certainly further energized daily by the collaborative work being done to stabilize families in closing the gap on this goal. With the grit and determination that has propelled society throughout time, we will continue to advocate for the solutions we know to be so close within our reach. We know the cause to be righteous, and we know it to be solvable. We know the issue is as important as any infrastructure activity is for any city. While everyone understands that roads, bridges, hospitals, and airports are important to a community's ability to prosper, our team and the Muscatine community also understand that therapeutically addressing homelessness is just as vital. After all, what is a community if it can't offer the American dream for all of its residents? What is our community if we don't offer every single member the achievable opportunity to scrape out a better living for themselves? After all, great ideas and great people come from all walks of life. Without holistically addressing homelessness, we can't afford that second chance as citizens. We can't prop up someone falling in hard times, and we can't adequately care for our children and improve our community schools. To say that homelessness affects children and our schools is an incredible understatement. It's a well-known fact that every move a family makes due to housing instability can set the child back up to 6 months academically. Children who move frequently are around 90% more likely to have failing grades, 80% more likely to have negative behaviors, and 70% more likely to have poor truancy. Obviously, I think you can see that our future depends on the solution to homelessness. I said earlier that the issue is solvable and the solution within our reach. Let me explain. Based on our data, 80% of the people we serve in our homeless shelters come because they just got too far behind on the rent of their utilities, which is also consistent with statewide percentages. It is also posted on the City of Muscatine's website that the average rent in Muscatine is $764, and that we are 990 units short to be able to offer affordable housing to those men, women, and children living in our community making less than 30% adjusted median income. We can utilize United Way's Alice report and do some matter-of-fact concrete math to determine that a person working at the grocery store 32 hours a week is going to be bringing home $1,000 a month. If you take the average rent from that pay, you understand that $200+ isn't enough to pay for the utilities and put food on the table, let alone gas in the car, clothes for your kid, medications, etc. If we stop telling ourselves that the issue is too complex, we can start addressing the critical need causing the problem: lack of housing. I know Mr. Lofgren, who I believe may have joined us today, is making some inroads with the Prison Built Homes program as well as with the 657A program, and we certainly applaud those efforts. With the goal of stabilizing families, we encourage you to look at all the innovative partnerships, some of which you'll hear about today, within our community. I challenge all of us, however, to be more part of the solution. The Homes, CDBG, and LifeTech programs are all fantastic. MCSA plans to collaboratively and strategically see how they may ignite current projects and entice new ones. I'm truly blessed to work alongside an amazing and high-performing team, as well as an incredible community. Together, they are constantly helping me examine the root cause of an issue, whether it be for a particular client or a wider community issue. In the past year, I think it's obvious that our focus lifted to the pandemic mitigation. In late February, early March, with colleges closing, travel being suspended, sports programs closing, I know uncertainty grew globally. The MCSA team truly rose to the occasion. Our social workers were joined by the rest of their team and worked tirelessly with our incredibly resilient community to open up housing for 40 individuals in 1 week, allowing us to house them stably and not use hotels. This, and thanks in large part to the City of Muscatine's housing staff, who were also incredibly busy managing their own programs. Still to this day, MCSA has not had to pay for one single night in a hotel, which I know other people have done routinely. While this strategy and their efforts were incredibly fiscally responsible, the dignity and stability it offered to the men, women, and children cannot be measured. It goes without saying that we learned how to sanitize better during the pandemic and isolate better during the pandemic. Our food pantry had to stop serving hot sit-down meals, and we had to stop offering choice walk-in pantry. Refusing to stop serving, we quickly partnered with United Way Salvation Army in Kentport to provide groceries and hot meals hand-delivered to hundreds of people's doors, encouraging them to also isolate and stay at home. All of our programs stayed open and operating. The number of people who seek emergency shelter dropped significantly and continues to stay low, in large part to our improved processes and increased funding around rapid rehousing. With the moratorium in place, the number of men, women, and children being served by our homeless prevention program also dropped significantly, but also picked back up in June, July. This time with substantially higher amounts of back rent and utilities. Seeing these higher bills and knowing the need, we quickly worked to add the local power company and local magistrates that deal with evictions to our collaborative homeless prevention group that already included, long list here, city housing, county community services, community action, the local ministerial association, the Salvation Army, to be able to stabilize people sooner and catch them as fast as we can. This addition of the magistrates and power company, while boosted by the pandemic, will become an integral part of our homeless prevention program going forward. We continue to have open and efficient dialogue with Muscatine PD, Vince Models sitting here on my right, as well as the local emergency room, Andy Johnson representing virtually, in order to properly plan for any people within those departments that may need warm shelter. Once the MCSA team felt we had put as many of the possible protective measures and procedures in place, we refocused on our strategic plan. Our goal, as earlier mentioned, is to expand the offerings of affordable housing. To that end, we're proud that we purchased 2 outdated buildings in order to rehab them into the highest quality housing for the clients we serve. In order to increase the income of the people we serve, we have partnered with the Muscatine Community College. We offer support and housing services while the college offers a rapid and intense upskilling credential in the area of welding, allowing graduates the opportunity at a career paying up to and beyond $17 an hour. We hope to expand the 6 to 8 week rapid upskilling to other skilled trades, and have also partnered with another local nonprofit, Crossroads, to offer job training program for those that might not be ready for a skilled trade. In-house, we know that our building is strong and rustic. Owing its roots to the original YMCSA built in 1954, in fact, the pool is still down there underneath the homeless family shelter. However, amazing and in the right location, the building is, well, rustic. We will focus on assuring its appropriateness for future generations. Our current and future needs. I think it goes without saying that we need more affordable housing. Just heard that time and time again throughout my thought. I think repetition is just so important. So my staff, we don't bless them because they have to hear it every single day. I think we get more participation in the home, life tech, and CBG funds in order to rapidly expand the housing index for this generation and next. We need to continue to evaluate how we stabilize shelter funding as a necessary component of the rapid rehousing model. Due to limited affordable housing in rural communities, we know that rapid rehousing often cannot begin immediately for clients in need. Thus, safety and short-term stabilization will continue to be paramount during the homeless to housed transition. Perhaps aligning rapid rehousing funding to include 24-hour shelter stipend as an element of the collective rapid rehousing stabilization efforts to create deeper success and further protect our community's children and neighbors from predatory situations as they await housing identification and availability. Our building is strong, but it is old. The location has served this community and the targeted population well. Additional funds for renovation would be helpful in ensuring that the services remain in place for future generations. I know Muscatine is not alone in this, but expansion of both in and outpatient mental health and substance abuse programs are crucial for those that are hardest to serve. In addition, I would like to expand how we work collectively to increase workforce training programs. A while back, I walked into a retail store here in Muscatine. As I walked in, I ran into a past client. He said hi to me and I began chatting him up. I asked him about his purchase. He had a single 96-cent Matchbox card. He told me it was a birthday present for his 6-year-old son. This was a strong and proud man with an honest job. During our conversation, it became clear he didn't have a cake or a card. He explained to me that this was all he could afford and he thought the present to be more important for his boy than the card and the cake. I tell you today that these are the choices your neighbors are having to make every day. More often than not, it's probably between clean clothes and riding the bus. Hopefully together as partners on a mission, we can agree that the issue is solvable We will band together, repeat the successes of others, reinvent what we can in order to provide the chance of the American dream to all our citizens. I'm proud of all the work that has been done across our great state to end homelessness and believe these efforts to be just and vital. Let's take a second to hear from our community partners and how the community has come together to address homelessness in Muscatine. Mrs. Schaefer.
Thanks, Scott. And thanks for your comments. I too want to thank the folks on the line that have provided support, guidance, and opportunity to our community, both through your individual work as well as your organization's work and the difference you've made. Many of you know the Community Foundation exists to help address community priorities, and we often do that through funding organizations that are working towards systemic change, like MCSA. So we're another piece in the puzzle of the work that MCSA is doing. Their work in stabilizing and enriching the lives of our neighbors and children. We're a little bit younger than MCSA. We're only 21 years old. But during our entire history, we have been working alongside providing an array of funding sources to the evolving services that you're hearing about today from MCSA. And as we do that, we recognize that the issues the vulnerable populations face are just like Scott has talked about. They're complex and they're interconnected, and they can't be solved simply. And so one of the early grants we did was to, and is Sister Irma Reese on the call today?
Sister Irma.
Sister Irma, hello, shout out to the past director. So she was here during some of these phases, but one of the early things they did is they decided to purchase off-site permanent supportive housing when they realized they could stabilize families differently. And we walked alongside them in those choices. We routinely funded shelter stability services, housing stability services, domestic violence services, nutrition provision, which we know is an outcome of lack of affordable housing. We provided some startup funding, and Scott touched on this, but really the forward-thinking creation of the wellness, their health suites that they have downstairs. And Sister played an early part in that as well. But you know, now they have pediatric and adult dental clinic, they have an adult eye clinic, they've got health services, recently added the wellness services in partnership with Angie Johnson and the Unity Point crew. And now is expanding into mental health services. And I think the thing that is most important, and as we see it as funders in addressing a stable community, is those partnerships at MCSA and the partners that have come alongside them, they're giving comprehensive access of care where only barriers existed before. And we commend you for all your work as you expand your stabilization efforts around that. I think what also is important for those that aren't from Muscatine, you can recognize the credibility behind the organization. So the financial gifts that the Community Foundation has given over the years are recommended by a variety of volunteers that sit on a variety of different granting committees. And so what they do is they've all singularly, through their granting choices, have shown their belief in MCSA and how they better serve. And that's been done repeatedly throughout the years. I think that MCSA showed integrity in how they serve their clients as well as how they steward their gifts. I think that stewardship is a reflection and a legacy of the team, of the leadership, of the boards throughout the years, excuse me. But I think the credibility of MCSA in our community and the stewardship they've shown is best recognized when another community partners alongside of the work they're doing. I think it's best recognized every time a funder gives a gift. I think it's best recognized every time a community member opens their pocketbooks and their heart in thanks for the work that's occurring. And I think that the work of MCSA does, the actual work that MCSA does in our community is most easily recognized when a life is better, whether it's by moments or by a lifetime. And I thank the team, I thank Scott and the work that goes on. I thank all of you for the part you've played in allowing MCSA to evolve into the services they're able to provide today and the difference they're able to make in the lives of our children and neighbors.
Thank you, Charlotte. Madam Mayor?
Thank you so much. I want to say, I want to talk a little bit about two different hats that I wear. So first of all, wearing my mayor's hat, I can say that I'm going into my 6th year here, and since day one, I have had nothing but good responsibilities met by MCSA. Anytime that a need comes up in our community, people look to MCSA and they're never disappointed because Scott and his team has always risen to the challenge. As soon as COVID hit, they didn't shirk from those responsibilities. They said, how can we help? How can we modify and change our services to meet the needs of the families? So no matter what it is that comes up, it's wonderful how they're able to think outside the box and continue to adapt their services, because we all know our communities change day by day, and you can't remain stagnant in your programming, and that is no more evident than right here at MCSA. Wearing my other hat as the Director of Family Programs at the YMCA, we began partnering with MCSA from their inception. We met with Muscatine County Community Services and worked to put this program together to serve the needs of our community, and we have extended that throughout all of this time. We have a program there that works holistically with families to teach parent education, to teach self-sufficiency, to provide respite and family focus. And we partner with MCSA by providing transportation and resources for all of the people that they work with to come out to our facility, or sometimes we come here and meet them where they're at. And we try to work with the family on some of the root things that can help them eventually work into a more sustainable life for them and their family. And MCSA has always been able to help us carry that torch to the families here in Muscatine, no matter what their needs are. A few years back, when we started a new program called Following the 24/7 Dads curriculum, MCSA, I'm sorry, I forgot to take my mask off. MCSA was right there to open their doors and allow us to bring the programming right here on site to the fathers that they work with and help them become that supportive role in their families and strengthen their family, both with the relationship with the child's other parent as well as the entire family. Meeting those self-sufficiency needs of the family can help in all of the other ways. It can help us with the society problems that we have with domestic violence, with substance abuse, with mental health. And MCSA is critical in helping us holistically work with the families and help them rise above, and certainly above the Alice threshold that, is Shane on there? I don't know.
Shane is on vacation.
Shane is on vacation.
I have a report from him.
So United Way, as you know, has done a lot of work focusing on the Alice threshold, and a lot of the people that Scott works with and his team right here has done a lot to help those families rise above that and be able to meet their families' needs. As you say, the people want to take care of their own families. They're not looking for a handout. They're looking for how we can help strengthen them so they can take care of their own family. And I think that giving that pride to the families and be able to meet and work with them with integrity like MCSA does is critical for Muscatine, and that is a service that is well provided here by MCSA, and we're very lucky and thankful that they're here in our community.
Thank you so
Thank
much,
you.
Mayor. Can we hear from Mrs. Johnson, the Executive Director of the local hospital?
Happy. Thank you so much, Scott, for inviting me. Can I get a quick thumbs up? You can hear me? All right, awesome. I love thumbs up. Thanks again for inviting me. I love any time or opportunity I have to talk about the great partnerships we have in the community. First and foremost, I just want to say, as a community leader and lifelong resident of Muscatine, for those that are new to Muscatine or don't have as much knowledge about Muscatine, you heard the word partner numerous times. And I want to give kudos to all the leaders in the room and on the call today. That partnership is really what makes us successful to focus on our community needs and help us move forward to improve our communities. So I am thankful for the partnership and thankful for being part of the Muscatine community. It's an honor each and every day. Second, Unity Point Health's goal is to improve the health of the communities that we serve and show our patients how much they matter to this world. If I were to take health out of that, I would say each one of us' goal is to improve our communities. And we do that through those partnerships that we discussed in many ways. We look for opportunities to find the true root cause, dig in, take those barriers and remove them. So to Scott's point earlier in his message, we don't put Band-Aids on it. We don't ignore the issues. We tackle them. We have some hard, crucial conversations, and we try to make it happen. And some of those ways that we've done it in healthcare, as you know, if there isn't food and shelter, then health is not going to be something that's addressed. And we know there's a lot of health inequities in our community and looking for ways to break down those barriers. And that's through the wellness clinic that we have at MCSA. And just a minor strategic item, we host those wellness clinics simultaneous to the food pantry and some of the dental clinics, et cetera. And that's intentional. Again, knowing that those individuals are going to be there for food and shelter, then we can partner with them on their health needs. And there are so many success stories over the years that I could share with you. But one example would be a diabetes patient who wasn't receiving their insulin or their diabetes needs and was in a really frail state. We were able to capture that through the wellness clinic just by them showing up to receive food at the food pantry, and then connect them with a primary care provider. They are now doing well, and they routinely visit their PCP on a routinely basis to keep their health where it needs to be. So those are just some of them. That's an example of many items that we do to help support. The last I want to highlight is our mental health services. Mental health is an area that we'll never have, well, I shouldn't say that. We are going to find it in Muscatine. We are going to find all the resources we need to serve mental health needs within our community. But at this time, no better partnership than we have with MCSA, again, to meet the needs of those patients. What's most awesome is the peer drop-in center, because patients are able to talk to peers who have been in the same boat as them and can relate to their needs. Lastly, I just want to say what I love most about Scott and MCSA is the relationships that they've created. Again, they're never shy to reach out to the partners around the table and say, hey, we have a need. How can we talk through this? How can we work through it? And at the end of the day, we always have the community and the individual at the center of the conversation to do what's best. There's no egos at the table. That's all set aside, and we really make it happen. So again, I'll just end on giving a shout out to Scott and the MCSA team. If they didn't build those strong relationships, we wouldn't have the community partnerships we have to make a difference that we do each and every day. So thank you, Scott, and thank you for inviting me and having the time to share.
Thank you so much, Andy. Mrs. Goodwin?
Good morning. I'm happy to join you from MCSA. I'd like to echo everything everybody said about the awesome work that MCSA does. And I'm just going to kind of go through some of that work we do together, but know that it only touches on what actually happens over here. And I know that because I throw a lot of stuff at them.
She does.
I began working with MCSA about 5 years ago when I came to town, and my first surprise was just the array of services that MCSA and the city actually had to offer those that are at risk of homelessness or experiencing homelessness. Came from Reno, Nevada, a region of about 400,000, and I would say that, especially scale-wise, we had all of the services that we were regularly able to access in that community as well. So it was very nice to come here and learn that we were ahead of that game. We did not have a dearth of services like many rural communities do. I was even more pleasantly surprised to learn that the city already had a relationship with MCSA to provide services to our municipal housing authority clients who were at risk of losing their housing. As many of you on the call, all of you on the call know that if you can prevent somebody from becoming homeless, it's much better and much more economical than letting them fall into the shelter and then having to be picked back up. So, but that partnership did focus on those people who were at risk of losing their housing at that time. So we took that and we kind of grew it into how do we get people who are on the voucher into housing when they're struggling to find housing, and then keeping them sustained. And this is where our first episodes of here, MCSA will fix that, because it didn't matter what they were at risk of losing their housing for. It was like, go talk to MCSA. And so they picked it up. Scott and his team honestly do the heavy lifting for the housing stabilization that happens in the city. And the city just serves as a supporting actor to that. Our first partnership, in addition, after I got here, was actually working on increasing the resources, and through that, pursuing continuum of care funding, which we hadn't actually received in the community before that. So MCSA secured a grant and took on the lead establishing the regional coordinated entry. So I think that they stepped up in both instances. They didn't have to, they could have said, no, we're busy, we're at capacity, we can't, but they did, and they continue to do those activities and take on additional programs. As you can hear from everybody who spoke before me, they developed a partnership with MCC that allowed their families to get that skilled training, but then they invited us to offer it to our clients who were in precarious needs. So to help them move on from just being sustained in housing to finding more fulfillment in their day-to-day life, as well as increased incomes. So, and then sorry, I am not feeling like I was overwhelmed the last discussion. I didn't listen. I was not here in person, so I'm like, I think this is awesome, but I'm a little distracted by what I want to remember about what's going on. Maybe. Anyways, so for me, for housing, it's important for staff that works in housing to recognize the unique position they are in and how that can be used to help families change the trajectory and potentially interrupt the cycle of poverty for their children. Helping each family in this way impacts those around them and affects the quality of our communities. As community development director, that's obviously one of my goals. And so within the housing agency, which I oversee, we looked at how our programs could be used to actually help support MCSA programs, not just continue to give them work. And as a result, we set up a P2 voucher, which gives priority to individuals who are experiencing homelessness to receive a voucher immediately so that they can be rehoused in a stable manner that they can afford and continue to receive support services through MCSA. In addition, we allocated project-based vouchers to MCSA so that they could purchase and sustain and maintain a property for supportive housing that is in the same area as the shelter, so they continue their efficiencies of scale, but are able to expand their housing services. And then MCSA has also partnered with the private entities to increase the access to housing for their clients, and all of this while continuing to expand the array of services that everybody around these tables has talked about. The whole world is just different. So, but I believe these endeavors and the community partnerships help set up MCSA to deal with the needs that came out of COVID-19 in a rapid fashion. We did when it was like, we need to clean out the shelter because that was the recommendation. It's like, how do we get those folks in? Fortunately, at the same time, HUD made some tweaks to their rules that allowed us to tweak some things and actually be helpful again when Scott asked. Again, normally it's the opposite direction, but I like to return the favor occasionally. So
You like it when you do too.
we try. We continue to work with MCSA and our other partners to identify the barriers of obtaining and sustaining housing, from looking for opportunities to improve the housing quality, one project at a time, or helping to support the programs that MCSA implements with their other partners, and helping our clients also access those services, which thankfully MCSA and the partners that are on the screen or in the room actually help to allow us to use that. I think one of the things about Muscatine that is really nice is that no matter which program sets it up, it's for all. I mean, there are very few programs in the community that if this organization, MCSA primary, as a prime factor in that, sets up a program, they make it available to my housing clients, to the Salvation Army clients, to the Y clients. It's like the mayor was talking about when they wanted to set up a program and they needed space and they needed that work for the clientele, then you ask and they offer. I mean, it's really hard to get a no from Scott. I think I may have once, but not really. I don't think so. So we just continue to develop the array of services, and I think our small town of 20-some thousand people, not even 25, so just 20-some, really does have a gem in MCSA and the approach we take to serving our clientele and our residents. and trying to make up for Scott being long-winded, so.
Sorry. Thank you so much, Jody. You're a great partner, a great friend. We couldn't be as successful as we are without that partnership. So kudos to everything you do. I guess we swapped out. You were on vacation last time. This time Shane's on vacation. However, I will read his words. Shane Orr is the executive director for the local United Way, another funder of our services. So I wanted to make sure we had his input in here. So he provided us a report because he wasn't going to talk to us from the shores of wherever he is. I'm sure it's someplace amazing. So he says, for the past 10 years as executive director of United Way of Muscatine and chair of the Muscatine Housing Cluster, our local housing trust fund, I've seen firsthand the differences that MCSA makes in the lives of the people in need in our community. Many homeless shelters across the country are only band-aid to the problem. MCSA is much more than that. They work hard to improve self-sufficiency and housing stability for families long-term. And when there are commonly discussions about how to help families during the toughest times in our lives, MCSA is always willing to go above and beyond and do whatever it takes to provide families with what they need to get back on their feet. As United Way has shifted our focus to improving self-sufficiency, MCSA will be an essential partner and the sole provider of many of those services in Muscatine. That's why United Way of Muscatine has been proud to partner with MCSA on community housing needs for decades and look forward to working with them for many more years to come. Sorry, his writing was really, really small. When I prepare, I make my words really big. Lieutenant Motto.
Thank you, Scott. First thing I would like to do, as being someone who's personally observed the growth of MCSA as being a board member for approximately 8 years now, I think it's very important to recognize Scott and for him, Charlotte, as things have progressed and changed and fluxed in terms of funding, in terms of availability of programs. The MCSA continues to expand and offer what I think, and from what I've seen in research, one of the premier facilities of any community this size within the state, possibly within the Midwest, in terms of getting folks not only housed, but making their lives better and making a difference in their lives. And that is purely because of the dedication of Scott, staff, again, Charlotte, for them. And again, I just really like to recognize you guys and the tremendous work that you do. For all those in internet land, who is, I can personally attest to that. I think the partnership with the police department is best described as a tremendous asset. The police department in many situations is involved with calls for services and incidents wherein we're dealing with subjects who may be experiencing mental issues, mental circumstances that have put them in interaction with the police department. Also could be related to drug abuse or lack of financial stability. These are not necessarily violent offenders or people that are career criminals. It's just, for the lack of a better term, unfortunate victims of circumstance. By definition of our work, we have law enforcement. That's what we do, is law enforcement. So our primary tool that we can utilize to alleviate the situations and incidents encountered is to make arrests and to incarcerate. In a lot of these situations, when we have these particular subjects of which I'm speaking that we are encountering, that's not a good solution. That's not going to solve the problem they're experiencing. Putting them in incarceration or adding additional fines that are levied by the state is not going to change their circumstances. In many cases, it's going to actually make it worse. And when we have encountered those types of subjects, having a facility like the MCSA to be able to call the drop of a hat, open 24 hours a day, 7 days a week, and be able, instead of going the route of making a law enforcement action, be able to bring them here where they can have structure, where they can have a roof over their head, and not only that, be able to have a future that they otherwise would not have. It is a great asset that we have, a great tool that we can utilize as an alternative. And quite frankly, recidivism. We have people that I can attest to that personally. of encountering those that have been interaction with law enforcement that I haven't seen for a while, and I've known they've been involved in the MCSA program, and I've run into them in different locations, not law enforcement interactions, but at a come and go or other places wherein, hey, I haven't seen you in a while. Well, they went through the MCSA program, they now have a house, they now have a job. We're not seeing them anymore, and that's our goal. And that's, again, something we would not have as a law enforcement agency, have an option to do without MCSA. I would also say it has another aspect of it has to do with what Scott mentioned with the domestic assault program. Again, our primary function is law enforcement. However, is that necessarily going to solve the problem? We don't necessarily have the resources to put someone in a safe place, put someone who's going to have touch with counseling and going to be able to be getting out of the situation, which is primarily what they're going to be needing in a lot of circumstances to get away from that. That's something MCSA provides. We take care of the law enforcement side of it, but without MCSA, having people that may return to these dangerous situations, would not have any type of counseling to help them build their lives up to be able to move forward and out of these type of environments. Without them, again, recidivism rates and those that were not able to move forward through the life would not happen. So again, tool or asset to the department. That is the biggest partnership goal that we have, and the biggest way or best way I would describe it. And we're very pleased and fortunate to have MCSA as a partner.
I think it's worked really well having you, Lieutenant, on our board for the past almost decade. It's improved our communication. All of our staff have your cell phone number.
Yes, I know.
I'm sorry. So just the ease of communication, I think, makes a world of difference in how our different agencies and organizations work together to solve the issues that we see every day out there in Muscatine.
And I think it's a fair statement to say that it's unfortunate, but our agencies are going to interact. And if we have that good working relationship, as opposed to, again, having higher recidivism rates, we have people that are being successful.
It's true, and I know there's other communities where the police are just involved in pool meetings, where you're not necessarily involved in our pool meetings. That ongoing, weekly, daily communication is what has proved most successful for our community. So,
and there's many names and faces to go with it.
Plenty of names and faces to go with it. I've been on the streets plenty of times on the cell phone with Vince. What do I do, Vince? What do you want me to do? What do you think we should do? Trying to problem solve with the fire department, the police department, the ambulance. Situations you run across can bring tears to your eyes for sure. But thankfully, we have a great PD that we work with. Dr. DeWinter.
Yeah, so Vince, I think you should post your cell number in the chat here because I don't have it. And as the college president, I feel like I might need it. So that's my request. So I serve as the president of Muscatine Community College, and I'm proud to be part of a collaboration that involves educating and really making a life change for some of the clients of MCSA. And I just want to give you some more details about a project that has been mentioned by several of the presenters before, and then give you my thoughts on why I think it's been successful for all of us who've been involved with it. So the idea of partnership and collaboration, I think, has come through, very, very clearly. But I also want to mention that these kind of things, to really sustain them, require a vision and a clarity of vision of what we're trying to do in the long haul. And I believe that Scott and the members of the MCSA board have really stayed true to that mission. So in education, we're really talking about long-term changes. We want to change the trajectory of lives for the clients, but also for the children of the clients, for those who come after them. And what we've created with MCSA's partnership and leadership is a short-term training program for clients who are wanting to make a change into a more stable lifestyle. And we started with a pilot project, and that was to take a few of Scott's clients and put them through a short-term welding training that was approximately 6 weeks. And at the end of those 6 weeks, we had arranged with several local businesses to hire the students who would have graduated then from this program. And so we created a pipeline of interested clients, supported them through the 6 weeks, and then we had employers at the end of it willing to hire our clients. And that was a successful first group of students, and that actually led to a more robust system of educating in this short term to add other programs. For example, certified nurse aide has been added, pharmacy technician has been added, computer numeric controls have been added, and we're always looking for other needs in our local community that can be satisfied with trained employees. We also learned that, you know, we can't leave anything up to luck. And so our efforts in terms of supporting the clients, not just by Scott's staff at MCSA, but also others, including Unity Point, Public Health, the Community Foundation, United Way, Aligned Impact Muscatine, and the businesses themselves have really, really strengthened. And we work with each student on their needs, be that transportation, or be that interviews, be that housing stability. We have walked alongside the students, I think, very, very well to lead us to this point where we can say, you know, an idea has turned into a system of how we approach things. And why I think it's been successful is, for one, we have constant communication between the partners. And that communication, you know, you heard from previous speakers, involves the details. You know, when should the college offer this next round of welding training? When are your clients available? You know, to how are they going to get here? Do we need bus passes to get them from downtown to the college? So it's very, very specific, and it's constant. We also, Scott, I think, mentioned the idea of grit. We see the other partners working so hard on behalf of their clients that has built a sense of respect for each other. And I think that's also very important when you have this kind of long-term partnership. We have a common vision, which is to end homelessness, to end hunger, to improve the lives of everybody within our community. From my perspective, that's through education, because that's a long-term investment in yourself and in your family. And so that common vision, I think, wraps us all together and keeps us, you know, doing the good work that we are. We also have utilized existing funding from the state, such as GAP funding, as well as private funding to help the clients afford these training opportunities along the way. So I think those are important aspects to lift up in our community partnerships. And I want to thank MCSA and the other partners for their role in changing the lives of our community members. Thank you, Scott.
Thank you so much, Dr. DeWinter. I also want to point out that Dr. DeWinter and Angie Johnson are both also on the MCSA Board of Directors. I did see a chat pop up, Jenny. I don't know if that was to everybody, or you want to check that real quick.
Scott, that was just me quoting Dr. DeWinter because I think some of what she said was so powerful. I've been typing some quotes in there, so pay no mind to me. But Dr. DeWinter, thank you so much for what you're doing. This is exactly why we are so passionate, and to everyone who's spoken so far, this is exactly why our council is so excited to convene this group of stakeholders, because to hear the work that you're doing and how it meets with that confluence of what Lieutenant and his department are up to, and Scott and everyone in the room. That's been incredible to hear so far. So very grateful for that. Scott, is there anyone else in the room who you'd like to turn over the floor to, or does that complete?
Anyway, Alex, I thought I would open it up to you and Tim to see if either of you had comments or if you had attendees that you invited that would like to make comments. I know that we're all together on focusing to end homelessness in Iowa. So please, if you have something you or Tim would like to say.
Sure. Well, I would definitely be privileged to introduce Tim briefly. Tim is a veteran member of the Iowa Council on Homelessness and does excellent work with Home Forward Iowa. He's been a key partner in helping the Public Awareness Committee stand up these meetings across the state, and just really grateful to have Tim as a mentor and in my experience on the council, and would welcome him to share anything that he has to add at this point. Thanks, Tim.
Sure. Well, thanks, Alex, and thanks, Scott, for inviting me. I'm not sure what entitles me to such a privileged seat here. Perhaps as the independent outside observer, being awed and impressed, and I am awed and impressed. And I want to do have a couple of comments, but observations. But perhaps I could talk a little bit about the council for folks that aren't. Yeah. So the Iowa Council on Homelessness is one of, gosh, there are well over 100 governor-appointed boards and commissions for brain trauma injury, for parks, for utilities, for all kinds of interests and activities that affect Iowans. The one that is designated to address homelessness in Iowa's 99 counties is the Iowa Council on Homelessness. And I think in addition to Jody and Alex, I see probably a handful of other members of the council that are here, and maybe some of them will chime in. So addressing homelessness, that is in the state, that is our goal, and we're going through some transition right now as a council. And I serve on under Alex as who chairs the Public Awareness Committee of the council that's convened this and meetings in other parts of the state. I'm chair of the nominating committee, and we're always looking for new members. So if you're interested in serving on the council, get your application into the Talent Iowa Bank. I'd be happy to talk with you more about that. I'm here in the area because I'm meeting not only for the first time with MCSA, which is the lead agency for for one of 17 coordinated entry regions in Iowa. Coordinated entry is simply the system by which people get from being experiencing homelessness to being housed. And happy to be here. Sorry, it's my first visit, but I'm nonetheless here to meet not only with MCSA, but some other agencies that provide services, shelters, and so forth. Homelessness, which again is in charge of the Iowa Council on Homelessness, at the community level at least, begins with recognition of a problem and culminates in affordable housing that matches that problem. And there are so many forces crucial to that, and I'm so heartened to hear about the partnerships and collaboration that happens here. The shelters, the law enforcement, education, domestic violence service providers, funders, of course, community foundations, United Ways, housing trusts, healthcare providers, addiction treatment centers, and so forth. And all of those entities are necessary, but the only real solution to homelessness is affordable housing. And I'm really heartened to hear that that is clearly the focus here, that the recognition I mentioned is evident in not only the mayor's comments, but also just everything that's happening that you talked about. And what I am hoping we can do is share the model that you are in the midst of that you've developed and that you continue to use to address the problems here, is to share that so that we can get more Iowa communities engaged to the level that things are working here in Muscatine. So with that, Alex, I'll turn it back to you or anybody else that wants to, from the council that wants to speak.
Thank you, Tim, so much. And Scott and MCSA team, I would offer that Tim, as a seasoned veteran, as a somewhat consultant to dozens of providers over the years, to get high marks from Tim means that you stack up quite well in his his long experience. So well done. And Tim, thank you again for all you've done for the council over the years. You've been such an asset to me as a newer member, but to everyone else along the way. So thank you. And I want to hop over briefly here to some of our virtual attendees. Foremost, I would love to just speak briefly here with Representative Cisneros. If you would just introduce yourself and tell everyone, Representative is a freshman in the Iowa legislature representing MCSA and the Muscatine area. Representative, we're grateful to have you with us, and feel free to make a few comments about your priorities this session and how things are.
I see he's trying to unmute. You can't unmute. Oh, looks like you're unmuted. But I can't hear you.
I think you're unmuted now, Representative.
I can't hear.
Well, while he's figuring that out, I really do want, I've heard people say Scott and MCSA team, Scott and MCSA team. I have an amazing team. They are the ones driving this. I'm just the one that goes around and says hi to everybody. But they are on the streets, they are in people's homes, inspecting the homes, dealing with client behaviors, trying to make sure that people are in the building and behaving and have food in their bellies and that their kids are going to school. So I just really want to say thank you to all of you guys and all of these great words that people are saying about MCSA because of the work that you guys do. So every day I'm just amazed at the perseverance and passion that you guys all have. I just want to make sure I put that out there because they are quite the team. Thank you, Tim. And Tim, you know, you've just, like, the way you come across is you really just want to help. I can tell it's a passion of yours to end homelessness in this state. I've never once been intimidated or hurt by anything you've said. It's always just meant with the best intentions. So thank you for all the work you've done. Did Mr. Cisneros get that figured out on his end? Doesn't look like it. And anything else from your side, Alex?
You know, in listening today, I just come back to some of the key words that we've heard about, you know, the partnership, collaboration, the empathy from MCSA, from the police department, the empathy that I heard from you, Lieutenant, and your team about how sometimes what you can do is not the best thing for someone you encounter, and the way that you're so adaptable and able to realize that and within reason accommodate individuals and partner with MCSA to do that. That just speaks so much empathy and partnership to me, but also the resilience and pragmatism of the leadership at all of the organizations that fund and support MCSA and its mission, from the community college to the hospital system. You've overcome challenges this year, a multitude of them, but also been pragmatic as you've done it. And I think that speaks to the ability for all of you to sit down and get, like you said, Scott, to come at things with just the most honest, candid advice and say, what's really going to work here? What's really best for our community and for the people here? So I've been impacted by all those things, and I have some great takeaways from today. But I do want to give a special chance for a few more folks who are joining us virtually to chime in and just say a few words if they'd like. I know we have Claire Lindahl as well, who's a newer member of the Iowa Council on Homelessness, comes to us with a great passion for all things public awareness and community advocacy and education on this issue. So Claire, I just wanted to give you a brief chance to introduce yourself and say hi to everybody.
Yeah, thank you so much. I feel like the generosity is continuing with Tim kind of onboarding Alex, and now Alex taking me under his wing. And I am not a provider, just a member of the general public. I do some nonprofit leadership, but have worked with the homeless community in the Des Moines area. And I'm just really looking forward to being part of the Council of Homelessness, to identifying the issues, raising awareness, and coming at it from a perspective of someone who's not familiar with the issue. And I think that can help me engage new communities in this. But this has just been an incredible event. I have learned so much. You're doing wonderful work, and I look forward to being part of helping to advance it and emulate it. And special thanks to Alex and Tim for their work on this, and for bringing me in and allowing me to be part of it.
Thanks so much, Claire. We also have a few other members from the council. It looks like Gary Wickering was on. Gary has been a longtime supporter and has been key to a number of initiatives over the years too. Do we still have Gary with us? He might have had to pop out for a meeting. He's a busy man. We also have Cody Crawford. Cody, if you'd like to say a quick hello. Thanks for all you're doing for the council as well, my friend.
Yeah, I appreciate it, Alex. And I just want to say thank you to Scott and Angie and Naomi and the police department and the city. What you guys are doing is incredible. I'm working kind of as a project on the side with a community of the similar size, and trying to make those connections and get that kind of a project going is a complete project in and of itself. So my hat's off to you to not only start it, but to get the connection you've got in the community involved. And it's something that I think we should all look at and work toward.
Absolutely. Thank you, Cody. I don't have the complete list here pulled up. So if there's anyone else from the council at this time who'd like to say a brief word to everyone in person, by all means. All right. Well, Scott, I think that can, I just got a chat from Representative here. It says I'm back, fixed setting. Representative, any chance that you can chime in?
Let's try. Can you hear me now?
We sure can, sir. Hey, good to hear you.
Very good. Sorry, I apologize. I've been using all these different platforms. I forgot to change the settings on my phone. Real briefly, I have to run to another meeting. It's quite a busy place up here in Des Moines. First of all, thank you for sending me here to be able to represent Muscatine, and thank you for inviting me. One of the things I heard and is encouraging to me is all the work between the agencies. I have personal friends that have benefited from MCSA, and so it's always been an important place to me personally, because I've seen people grow after visiting that place and getting help. So one of the important things that MCSA does is give people hope. And that's what gets us out of the trouble that we're in, when people come around and give us hope. So thank you guys for being there. Thank you for working together. And I hope to be able to help what you're doing in the community. So thank you.
Thank you, Representative. And as a freshman at the State House, you certainly have dived right into some key policy work, and I'm just excited. If you didn't already know Scott and his team, for you guys to be able to forge that connection here and to continue to work on these things and to stay in touch as this session and future ones roll forward. So thanks for being here today.
All right, I want to be respectful of everybody's time. I know we have some incredibly important people in the room and online. However, I did want to open up the chance for any particular questions and answers. You do have quite an array of people on the line and in the room that can answer questions on how we're addressing homelessness or push on how we can address homelessness better. I know we have some members of the media here with us today, so I will turn it to the room and the virtual world for a question or two.
There's one in the chat if someone wants to answer that one. Someone said, great presentation. Can you share how the pandemic transformed your work this past year?
So the pandemic put a halt on everything. I think the entire globe was nervous about what was going to happen and how we're going to stay safe. So like I said, the staff got incredibly innovative working with the city to house people. 40 people in 1 week they housed, and I think that was absolutely amazing. In-house, we've been looking for every piece of funding we can to make sure that we can make people isolated. One of the buildings that we purchased, an outdated building, it's still livable, so we've made that available to us for a quarantine house. Should we have a client that comes in that needs sheltering, that is also COVID positive? So far, knock on wood, we have not had one client nor one staff test positive for COVID. We've had scares and we've had nerves, but my staff is very proud of the work that they've done. They have not missed one day. No one's called in sick. And while they were scared, they come to work every day and come to our morning huddle every day, ready to solve the issues. So the traffic in the building, we've done everything we could to decrease the traffic or deflect the traffic while still serving. So the biggest effect was to our food pantries. We like the dignity involved in a choice pantry where people get to pick what they're getting for food. We had to stop that. I know we also did hot meals, and this was a hard one. At the very outset, I stopped our food program coordinator and said, let's stop the hot meals. And she said, okay. And then the next day, we were in the dining room together, and a lady walked in, a pretty well put together lady, and she was really quiet. And the food manager asked her, "Are you here for lunch?" And she said, "Yeah." She nodded her head, yes. And then the food coordinator said, "I'm sorry, we're not serving lunch anymore. We're going to be doing hot meals next week to serve to people's doors." And so the lady, without saying anything, just walked out, and I could see in her face that she was crying. So it really impacted all of our team incredibly emotionally. But we found ways to be creative, to be innovative, and still get food to people's doors while being safe. So I think pandemic-wise, that was it. And it took quite a few months to make sure that everybody was safe, everybody was wearing their masks. Amber Lewis was here when we had the HUD visit, and she kept remarking, where's all the clients? Where's all the clients? Well, they don't really like being in the building because we make them wear masks when they're in the building. So they're usually out looking for jobs or talking with folks. They just don't want to be inside the building wearing masks. So again, that traffic has decreased, which kind of breaks my heart a little bit because we have some amazing social workers and we have some amazing frontline staff that can do some really good behavior modification if they're in the building. However, we have to take things as they are. The pandemic is a reality, and we will do what we can with it.
I was just going to add, as a community member, MCSA and many of the nonprofits mobilized incredibly quickly around whatever change was happening. So it didn't take them weeks to decide how to take care of them. Once they evaluated need, they dug in, often not knowing if they were going to have the funding to support them, but they dug in to provide the services in the best way they can figure out how to do that in time. Luckily, as a community, many of the times we were able to come forward with the funding in support. But those kind of questions weren't slowing the delivery of meeting the needs of our community members as they were very quickly changing and they were adapting alongside of that.
Any other questions or comments from anyone in the building or in the virtual world there? All right, then we were.
I did have a quick question for Dr. DeWinter, if she's still available. I wanted to just hear about the future of that job training program. Where do you see something like that ending up in maybe 2 or 3 years' time? And maybe have you followed on with any other community colleges to try to export that model to other areas with similar resources and potential for something like that to get off the ground?
Well, I think there are two ways to look at the future. First of all, we know that we're offering short-term training for these clients. So 6 weeks of welding, for example, would allow them to be successful in an entry-level welding position. But what we'd like to do is really instill in them the hope, like we talked about earlier, that they can add on to that training and, you know, have the chance for even more advanced positions within the community. So I think investing in the individual, this is just the beginning, and hopefully with success of seeing that connection with the business and industry, and the stability of the positions, they would be inspired to do even more. So I think that's one way to look at, you know, where do we go from here? We're also interested in exploring other programs and other areas where this model can be successful. So I think it's not in every area that you can break it down into a shorter term, you know, training and then have the person be immediately employed. So we have some limitations there, but I think I mentioned that pharmacy technician was something that was just added recently, and that was in response to, you know, the vaccine and different efforts around COVID-19 that have just changed where we need workers. And so I think, you know, really staying in tune with business and industry needs will be important so that we can respond with new types of programs, you know, that are going to really hit the mark here. So as far as, you know, can this model be applied to other communities? I believe so. But you can see, you know, that it takes really everyone rowing in the same direction. But I know that, you know, we would be happy to share our advice and, you know, our stories with other communities who'd be interested in taking something like this on.
Any other questions or comments from anybody in the room or in the virtual world? Okay. Anybody who knows me knows that I could share stats upon stats upon stats, but I know I'm also preaching to the choir. So I ask you to remember as you leave today the story of the man buying the 96-cent Matchbox car. I ask you to remember the choices that your neighbors are having to make for their family and for their kids, and to go out and continue to fight for the cause to end homelessness. It must continue. It is solid, and there is hope. And thank you guys all for coming. Enjoy the rest of your guys' Tuesday.
Thanks, guys.
Thank you.